Perfect. Thanks very much. Welcome, everybody. Thanks for joining us today. I have up here our upcoming session, the Downtown Music City Movement, with Mark Garner, Executive Director, Chief of Staff for the Toronto Downtown Young Business Improvement Association, or BIA. This is a great example of, a very hyper-local association creating a music city strategy and the impacts that it can have on commerce in the business improvement area or the downtown area. So really look forward to that. Obviously, the business improvement area for us here locally is the Downtown Association, or Queenstown, but technically the downtown geography for the city extends from the machine shop to Pine, and then from Water to Rail. So quite a larger geography. So that encompasses the machine shop, Roberta Bondar. It has a lot of heritage venues, clubs, restaurants, and theater. So this will be a great session on how we can be able to bring our music city together and help. Really, what we want to do is evolve our downtown. The following session then will be March the 24th, building your digital music business. And as many of you in this industry know, this really is the norm now. And, some challenges around how do you present yourself? How do you monetize it? How do you create presence and brand and amplify that on a digital platform? So please stay tuned for those, another couple of great sessions. But today, of course, we want to welcome Scott Ashley and Mike Minnick from Get Ready Global. And they are a pandemic and infectious disease firm with a great deal of experience. And we've worked with them on digital tracking and some of the processes that have to be put in place for many businesses to ensure that they're opening and reopening and following the proper protocols. So Scott has excellent pedigree, and in our conversation a few weeks ago, he spoke to, I think it was the Toronto Opera Company, and how to manage them getting back to business. So Scott, thanks very much for joining us, and Mike, thank you for joining us as well. Also, of course, we've got Chris Campbell joining us from Music Tourism. And Chris, can have some insights from his perspective as to what he's seeing in the industry, who's potentially booking, and when those times might be booking for. So looking forward to some additional comments from you, Chris. So thanks again, everybody, for joining us. And Scott, I turn the floor over to you. I encourage anybody to put your comments, questions in the chat box so that we can get those in front of Scott and potentially as well. So thanks very much. I just see here we have a Max Merrifield who has joined us from the Northern Lights Festival Boreal in Sudbury. So thanks very much for joining us, Mike, and please spread the word to all of your industry contacts about what we're trying to accomplish here in Music City. Not that we're trying to compete with Sudbury, but a little friendly competition is never going to hurt anybody. So thanks a lot. You guys have done some great things in Sudbury, and obviously it's a place that we can learn from as well. So Scott, it's all yours.
Thanks, Rory. Thanks for the introduction, and welcome everybody. This is really interesting stuff, actually. And there's the good news is we think there's a bunch of ways to do it safely and get people performing again and doing some digital, presentations, concerts, and so on. But we also think we can get the audience and the patrons back and so on. So what I'm going to do is just go through a slideshow. I want this to be more of a conversation than a presentation. So if you have any questions or comments as I'm going through, please, hi, my name's Scott. Just say, hey, Scott, what about this? Most of you, your mics are muted, but I think everyone can probably click on it and unmute it. So it's nicer if they stay muted during the conversation. But if you want to jump in on something, by all means, unmute and let's have some go. So anyways, I'll give you a little bit of background here. This is our company. It's called Get Ready. And I'm just going to go to a presentation there. Can you see that okay?
Not yet, Scott.
Oh, you can't see it. Okay. Well, hold on a second here.
I think I've got you as co-host, so you should be able to share.
Yeah.
Modern technology.
Here we go. Clicked on it. Okay,
You're
here we
not
go.
alone. I
think
actually hung up on a whole group one time.
Can you see that now?
We're good.
Okay, I'll tell you what. I'm gonna leave it in this view if that's okay as a slide as opposed to the. Well, let me see here if I click to the beginning. You can still see that. Can you see that? Okay.
Yep, that's excellent.
Okay. All right. So, anyways, listen. Welcome everybody, and thanks. My name is Scott Ashley, and I'm one of the co-founders. I'm the president and CEO of a company called Get Ready. We have about 45 staff. We are an incident management company. Whether it's emergency management, emergency operations centers for municipalities and hospitals and so on, or it's business continuity planning, pandemic planning. I'm a former critical care flight paramedic off the air ambulance off Orange, and I was working out of Sunnybrook and Sick Kids for many years. And every time we went to an accident, every time we heard the story, every time we went to a hospital, whatever, people always seemed anxious and didn't quite know what to do when these outbreaks were happening. And a lot of us worked through the SARS outbreak and then the H5N1 back in 2008 and 9. The way we describe it is infection prevention control. Every hospital in Canada has an IPAC manager, department, staff, and they look after the infectious disease elements in hospitals to make staff and patients and their families all safe. Now, due to COVID, every workplace needs an IPAC program, and this is where the problem is. There is no, sort of industry, Ministry of Labor IPAC. There's WMIS, there's first aid, there's, different programs, but there isn't one for IPAC. And so this becomes an important tool of what do we need to do to put this in place. And with your goal right now of reopening safety and running the safe festivals, we want to make sure that we have a plan, a process in place from the beginning when staff are there setting up, ultimately to when performers are coming in and backstage and they're rehearsing and getting ready for the show, ultimately the show itself or the event, the concert, festival, and ultimately the cleanup and the follow-up and so on. And so we look at all of these different areas. We've been working with the Canadian Opera Company for about 6 months now, developing their reopening plans for the Four Seasons Performing Arts Center. And there's some stuff about there. There's a testing tracing project, which I'll talk about in a little bit here, which I think you'll all find quite interesting that's happening, and it'll be a leading role for all of us and certainly within Canada to do some cool stuff. But first of all, we look at an assessment. We have 185 different elements, 16 different categories. So we want to look at the cleaning, the disinfecting, but we start right from the very beginning. How will people arrive at the festival or at the concert? Is this going to be outdoors? Is it going to be indoors? Is it going to be a bit of both? Are we going to have arena facilities or parks, or, where will the parking be? How will we tie this in with police, fire, and EMS? If we have a patient, what's that? So we start from the outside and we start looking in, and we go through the whole process, the access points. How are those going to be staffed? What kind of screening are we going to have? And some of these things I'm going to talk to you a little bit about now. What kind of PPE? What's the risk assessment? So the quick list, as you know, there's lots of people involved in these events: the producers, the performers, the stagehands, the wardrobe folks, and directors and playwrights, and equipment and food and ushers, and organizing these events. So there's a lot of moving parts, and so we need to make sure that we have each piece of these with a risk assessment. So who is a frontline staff person at an event like this? What do the performers wear? Do they wear a mask? Well, obviously they're not going to be wearing a mask. So what's a physical safe distance from a performer to another musician, to someone doing video, to someone in the audience? Or like a orchestra pit kind of thing, or where you may have some people playing, instruments off to one side or in front. All of these sort of things. So we look at what's the distance, what's the timing, what can we put in engineered barriers? Is there certain PPE that some people could wear? And then again, take off during, and then before they leave, they put it back on again. So there's a whole risk assessment. This is what we use at hospitals with paramedic EMS services. and it's what we incorporate to all of our client programs. But it's something that you should all be thinking about, and it's just called the Simple Risk Reduction Matrix. So have a look and think about that. Then the actual stage, and this is just a very generic stage, obviously. So we have the backstage, the stage, the audience, the lobby or the inner perimeter, and then the outer perimeter. And this may include parking, it may include road access points, or it could even include bus stops, or you know, if you think of big events, people might just be bused to a spot where they can get off. Maybe there's no parking right there. So, you know, how far do they walk? Half a block to this area? Or, so we just have to decide what the venue is, then start looking at the access. And then we start to consider all of the distancing, the fencing, the signage, the flow. And then we have all these pre-drafted signs with processes. We can look at occupancy levels. How many people could be backstage? How many people could be in the pit? How many people could be in the audience? Talking to the Stratford Festival, they're looking at a first round opening of maybe 25% seating capacity. So these are things that you know, we have to determine at the time. I know you've all been watching probably the highlights anyways of some of the sporting events, whether it's football or hockey or whatever, basketball, and there's not a lot of seats being used. So there's a process to that. There's a formula for that, and it's you know, it's fairly quick to do, and I think it provides good instruction to people what they need. What are the action plans and procedures? You know, how will you set up a screening? What exactly will your screening policy be? You know, someone says, no, I don't want to wear a mask. So what's your policy on that? What do you do if someone comes to the festival and says, I'm not wearing a mask? You know, does everyone understand what that rule is, or what we're going to respond to that? Do we have the right PPE for the different people based on their risk? Frontline ticket or frontline ushers or security, maybe in very close proximity, while maybe more backstage people or lighting might not be very accessible to the public at all. So again, they have different levels of risk. What's their training required? As an employer in Ontario, you must provide health and safety required training. If you give someone a mask or hand sanitizer or goggles or a visor, you have to teach them how to use that mask. And we see people all over the place pulling their mask down and drinking their coffee and pulling it back up again. And they've all been given masks. Most people have been given a mask. But I bet half the people have no idea how to actually wear it and remove it and put it on and take it off and dispose of it and so on. So these are elements we have to look at. The cleaning versus disinfecting. We can clean an area. We can, you know, soap and water, hose it down, whatever, if it's outside. But how are we going to disinfect a certain area? If we know that, you know, people in the backstage area or in a change room were COVID positive, then we would have to deep clean that area or fog it perhaps. And so what's the rules around that? So we just need to make sure that everyone has this procedure or all of these sets of different procedures. If a person phones in, you have someone from lighting and they say, look, you know, or setup or stage or whatever, and they call in and say, I just tested positive. What does that mean? You know, what does that mean to everyone else? Like, are we sending everyone home? So the question is, what exactly are we going to do? And it's these kinds of policies that we want to make sure in the procedure. So here's a procedure for staff if there's an exposure. Here's exactly what supervisors do, exactly what managers do, exactly what the director does, you know, the employer and so on. And then, you know, what's the communication that has to be sent out to these people? The screening is really a critical piece. The government's passed the legislation now that you must screen the people who are coming to events. Simple process here. We've been able to really make it easy. There's no onboarding of any of the staff or performers or the audience or anybody on the website, on their tickets, on an email invitation, and certainly on posters as they approach the festival area. We can have barcodes or QR codes, I should say. Everyone arriving can simply take their phone, hit the barcode or hit the QR code, and it opens up the app. They fill in this on their phone, or security could have it if someone didn't have a smart device, or another family member could do it twice. All the information, first name, last name, the site, the department, the email, phone number, all of that is captured it's without paper. There's no touching. There's no clipboards and supervisors trying to get all the paperwork organized. It's all done digitally. They click on it, and then if there is in fact an outbreak, they can easily send that, download the database of the people who were there on certain days, times, and send that to public health so they can immediately start a contact tracing. And as you probably heard in the news, typically they're over 3 days waiting from the organization to get the contact information. And by that time, the disease is obviously expanded and more people have been exposed. So the contact tracing is an important piece. Ultimately, this just comes in the IPAC platform. Everyone has the plans, all the managers and department leads and whatever have it all on their phone. They have it on their desktop, and they know what to do if there's an exposed person, their daily status reporting, and they can just go around with this and literally take pictures. They can, do you have hand sanitizer in place? Click, there it is. Do you have PPE? Yes, there it is. Do you have signage? Yes, there it is. So for your insurance purposes, as you run these events, you can prove that you are compliant with provincial and federal public health requirements. So you have the daily status. You can print this as a PDF if some people don't have a smartphone device or the Wi-Fi or whatever's in the case it is, then you can print these off. And this is a separate piece to the actual day-to-day program. This is what we call the POPI. So before I go down this road, first of all, are there any questions? Does anyone have any questions on anything that I've talked about so far?
And feel free to unmute and ask those questions, folks. I don't see anything in the chat here yet, Scott.
Okay. Yeah, but if you want to, unmute yourself, then please.
I have a question.
Sure.
If you're saying that we must screen people coming to an event, is that also the case for drive-through events?
No, if they are staying in their car, like at a drive-in theater.
Correct.
Yes, if they are staying in their car, if they're staying in their vehicle, then you don't have to record who's there.
But as soon as they get out of the vehicle.
If they leave their vehicle or want to come in and use the washroom or, even pick up any food, for example, then you would want to record their name, because right now what we're seeing is how close people are coming. And if you're using the washrooms. Now, if you have it set up that the washrooms are outside and they're not actually coming into the building, then you don't need to screen their names.
Okay, thank you.
Okay. Any other questions? All right, well, listen, I'll talk about this POPI tracer program. And I'm going to give you some numbers here. About 6 million particles are exhaled every minute when we breathe. So our breathing, our talking, sometimes people will see maybe a little spitball or something, but there are literally millions of microscopic particles that leave our mouth every time we breathe, talk, cough, sneeze, whatever, sing. We're sending particles out, and the reality is we can't see them. We met this group back in October called POPI Health. We've since that time partnered with them. They're a group of scientists who measure the pathogens in the air, and their byline is we make the invisible visible. So they can actually see and be aware of what's floating in the environment that we're in, either what's in the air or what's on surfaces. So the POPI monitoring system allows us to measure over 300 different pathogens, obviously including COVID, but also influenza or Ebola, all kinds of different C. diff, listeria, all kinds of different things. So it can monitor the presence of those. The reality of it is it does two things. One is it proves to staff that they've actually got a monitored system. So if you in your workplace, if someone came in, a custodial service came in and cleaned the office or the warehouse or whatever, and the next day staff come back into work, people will say, well, how do we know it's clean? Well, you don't actually know. you assume it is because it was clean, but you don't actually know. With the POPI system, we can now know. We know that people are afraid of the asymptomatic shedder, the person that does not have any signs or symptoms. They do not have a fever. They do not have a cough, shortness of breath, loss of smell or taste or any of that. So they feel fine. They come into work, they're wearing a mask, but they still may be shedding virus. What the POPI system does is gives us 5 to 7 days advance notice of a person who may be positive, and therefore we can begin to screen and prevent these people, and therefore prevent the outbreak, prevent the reputation, and the potential damage, obviously, to the organization. So this is what we're doing. We're doing this test, a series of projects down at the Canadian Opera House. It's going to be on 2 locations, but essentially at their main Four Seasons center. So they have a front area, a lobby area where they do performances, and then they have their big stage and backstage area. We're going to be testing these things to put the POPI devices out and be able to put up barcoded pathogens so we can actually track the airflow, the amount of hang time. One of the questions we had, and some of you guys will be thinking about this, for the festival, the music festival. And so if one band gets up on the stage, so you have a lead singer, you have, piano, guitar, whatever, woodwind, drums, you have 4, 5, 6 different people maybe. Some of them could wear a mask, some of them, because they're playing an instrument or they're singing, will not be wearing a mask. And one of the questions is, when the when the performer is singing, how long do those particles remain in the air before the next group of singers could come in? Well, right now it's a bit of a guess, and we're doing a test with a resulting published paper on this. We're hoping that it's out by the end of March. So there's a race to get this information and to get this project done. And I think people will find the results quite interesting. We got a paper from Germany that we were using with the ballet and stuff. And it said that opera singers needed to be 12 feet apart, and they had no validation of that number. Obviously it's double 6 feet, but is 6 feet, is 12 the right number? So we don't have any real scientific evidence, and now we're going to have that. So I just wanted to share that with you guys, that this is something coming down the pipe, and that when this is done, this will be released, and it should provide some scientific validation of the distances that we're talking about. We also have a 30-minute online training program as part of the program, and this meets all the Ministry of Labor requirements for protective equipment and so on, but it also talks about diseases and how they spread and the terminology and what's an incubation period and a quarantine period and an isolation period and all of these different components. So it's 30 minutes online. It comes with a certificate, but it's part of our certification process. And ultimately, when an organization uses our screening and our procedures, and they take the training with the staff, they then get a certified IPAC workplace program certificate to say that this site is now compliant with public health from Public Health Agency of Canada federally, and provincially as well from the Public Health Ontario, so that we meet those guidelines. So that's really what the program's about. It's a start from the outside and sort of move in. How will people arrive? How will they park? How will they screen? Once they come in, what's their PPE? What's their physical distancing? What's their seating arrangements? How are we continuing to monitor the site and keep it safe? If we have an exposure, how do we track it? How do we minimize these things? And it becomes, it's like spokes in a wheel. The more spokes we have, the stronger the wheel, the more complete the program is.
Scott, we had a comment here in the chat from John. Everything here seems to need digital connectivity. Not all have that capability. Most, but not all. What about non-compliance with tracing? I guess that's saying, how do you have a paper-based compliance?
So if you don't have the phones, if you don't have that capability, you can record it. You can have a staff person, with a pen and paper kind of thing, and just recording the first name, last name, email, phone number, and what we always try to record is the relationship to the or affiliation to the organization. Is it a staff person you're talking to? Is it a customer? Is it a vendor? Is it a performer? Is it a backstage? So that you can quickly figure out and sort by, if you needed to notify all the performers because another performer had tested positive, it would be good if you had that list that you could sort by performers so you could contact the other performers quickly, all right, and easily. So if you don't have a digital system, you can do it on paper. If you have a small group, you may as well do it on paper anyways, if there's only a handful of people. But as the organization gets larger, as you're tracking more people, it'll just end up taking hours and hours and hours to record all this information and to share it and organize it. So sometimes it's easier. And if people don't have a digital, smartphone device, and not everyone does, or they had one and it broke, or the battery died, or whatever, then they can either use a friend or family member's device, and they just do the same thing twice. The first person taps on it, goes to the QR code, gets the app, fills it in, and hits submit, and they're done. The next person takes their buddy's phone, clicks it, and does the same thing. Or a staff person can do it if your staff members don't have a phone. They could do it, a manager could do it, or supervisor, security at an entrance point or on a laptop, they can do it as well. So there's a bunch of ways to.
Yeah, I think we've seen some instances where actually there's some security issues around a paper-based format, that people can gain easy access if the papers are left into the public, secure people's names, addresses, emails, or even that paperwork can get lost. So there's some challenges around privacy policies that an organization may have and how they treat paper-based, where the digital side can be secured by password, right?
Oh, it's definitely, it's more secure. You don't have people. We had one client that they were taking pictures of the sheets that people had filled out, and then suddenly all this information, a list of names and emails and phone numbers, was then on people's phones, and they were texting it to other people so they could see the list. And they ended up shutting it down really quick because the privacy issue became a real problem. All of our data is domestically stored in Canada. It's kept within Canada. All of our hospital clients, our corporate clients, municipal clients, everything is Canada based. So it's not like we're putting stuff on US based servers or servers outside of North America. And secondly, we're not capturing patients' medical information. And that's really important. People wonder about, well, now that you know that I had a cold. No, we don't know that you had a cold or a cough, or we don't know that. You're asked about 12 questions, and if you answer yes to any of them, then you fail the quiz, and you can't be, you're not going to be successfully screened. So yeah, no, that's a piece where all we end up with is first name, last name, email, and phone number, and your relationship to the organization, and whether you were successful or not in your COVID assessment. That's it.
Yeah, and as a follow-on from Megan, could you not track through an online ticketing platform, have people purchase or sign up in advance and collect contact info for tracing at that point? And one comment I would have here is that if you're using third-party ticketing, you actually may not be able to access that personal information. Hey, Scott?
Well, that's true for the one part. The second part is you would have, like, I might buy the tickets, a week in advance, but it won't, that ticketing system probably won't tell me the day I arrived or the time or when I left or where I was. So I don't know if those do all that. If you have to scan, like if you buy your ticket and then come through and have to scan to come into the the festival grounds or the facility grounds, and then it tracked when you left. So if you had that capability, then that probably works, because you would have your name and your phone number and your email if you buy your tickets online through that. So that's a system that could work.
Yeah, you couldn't control somebody buying tickets for guests, right? Or you wouldn't be able to control even the whole issue around scalpers, right? And
no, it's potentially trickier. I don't know how quickly you could get the information to public health. And at the end of the day, that is the number one goal of this whole law. They don't really care how you track it. They care that you can get it to public health in like, seconds, minutes.
Yeah, I guess, when you're looking at events too, you really have to, logistically understand what you need to do before your presenter even goes live, right? So you're talking about, when do you open the doors to collect all that data? How do you manage?
This 100%. And this, there's a bunch of ways. People getting a ticket could be sent an email. They could fill it out from home, just before they leave to come to the show. Most places will typically run it with a 2-hour wait time. So as long as you filled it, if the show starts at 2:00, as long as you filled it out by between 12 and 2, then we take that assessment to be valid. If you filled it at 8:00 in the morning, that's not valid. If you filled it out the day before, it's not valid. So we have to have you doing it just prior to the event, and then, then away you go.
I guess some of that's even more critical when you take a look at these new variants and how highly transmittable they are.
Well, it's gonna be a curious time to watch. Our medical director, a fellow named Dr. Michael Christian, is the head of the air ambulance program in the UK, overseeing all medical practice for the helicopter. In the UK, they send the surgeons to the scene, and Mike's working through the National Health System or service over there, NHS, and with the helicopters and so on. But the variants are causing a huge problem. They're seeing rapid transmission. And look, the faster we can screen people, the faster we can find someone who shouldn't have been coming there, or if they were, we can notify them to isolate with them and their family, and we can prevent these further outbreaks. Our healthcare system can be very quickly overwhelmed. And so if we can prevent, 10, 20, 50, 100 people being exposed and having a possible outbreak, it'll go a long way into managing that with our current, healthcare capabilities.
Yeah, and that's a key element to recall as well, is that this really is about ensuring that we're not overwhelming the healthcare system. We got a comment and a question here from Max. Says, "This is great. I know you don't have a crystal ball, but when do you think these types of policy protocols will be something we can implement in our regular events? The sentiment among a majority of medium and large music festivals I've talked to is essentially forget or pivot for 2021, look to 2022 for larger in-person normal events." And maybe, Scott, you can comment on that too, but I think Chris Campbell will have some insights onto this as well.
Yeah, go ahead, Chris.
Chris, you're on mute still, buddy.
Sorry about that. No, please go ahead. I'm kind of absorbing this myself right now.
Well, listen, the timing will be interesting as more people get vaccinated and we see how that goes with the variants and so on. It's a very positive thing. Personally, I have not had the vaccine, nor has my family, but when that opportunity comes, we will certainly take it. I know there's a lot of people anxious about vaccines, and every person has to make up their own mind. But I know one of the things that's not reported very well in any media is, we either hear the number of cases or we hear the number of hospitals or the number of fatalities. What we're not really hearing is how many people are really getting sick from this COVID, who are really picking up long-term health issues, with cardiac or brain or vital organs, the lungs and so on, that are being impacted by just getting COVID and being sick from it. If you had to spend a week in a ventilator, in an ICU on a ventilator, that's got a hugely negative impact on your body. And so, just like on the long weekends, you'll hear how many people were killed on Ontario roads. What you won't hear is, 85 people have broken legs and 5 people are paraplegics and have head injuries and this and that. And we're not seeing the same thing from COVID. We're hearing the number of fatalities and the number of patients, but there's a heck of a lot of people who are quite sick and quite ill. So we don't want to, nobody wants to get this disease if they can avoid it. And so, getting the vaccine is important. Tracking and monitoring this testing we're doing with Poppy and the deployment ultimately, I think will go a long way to indicating that the systems are either A, working, or that if they're not, we're going to have advanced notice. Again, it's the same thing as a smoke alarm, as a fire alarm system in a building. Yeah, you can have a false alarm, but you can also have a piece of toast smoking away in a toaster oven for 20 minutes, and the next thing you know, you've got flame. With the smoke and heat sensing, our buildings are much safer, as are our staff. Well, yes. So we are now with COVID, with this Poppy monitoring system. We can see the pathogens that are actually in the air. And, we can say, hang on, everyone who was in that training room, everyone who was in that rehearsal room, whatever specific event or function you're trying to do, it's like, okay, that's now closed. We need to have to deep clean these people who are in there need to be isolated and monitored so that we can identify any sickness and jump on it as quickly as we can.
I think, sorry.
So Greg, have you had a chance to study and get any data on I guess in Europe, they've been using these corral systems where they'll keep everybody in bunches. I guess little individual like bubbles that you go with your friends. Have these worked well? What's the?
Well, they can work very well, provided that people. This is what the NBA was doing last year, and they were keeping their teams in bubbles, and that's why the guys could sit on the bench without their mask on and so on, right? All it takes is one or two people to break that bubble.
Yeah.
And then it's what I call a bubble bath. And, suddenly you're exposed to all these other bubbles that you thought were all secure.
Yeah. I think what Greg's talking about, though, and I understand what you're saying. In South Carolina, there's a series, it's called Cola Concerts. And what he's talking about is actually, you think of the drive-in concept. Well, it's isolated areas. So, pods, if you were. So picture, literally a fenced in or a roped in area with posts that you and your 4 friends or 5 friends are in. That's it. Yeah. And you have to stay in there. Each pod is, separated by about 10 feet, and you do not leave your pod. Unless you have a mask on and you're going to the washroom or you're leaving, you have to stay in your pod.
Yep, that's fine.
And then the other, what they're doing is, if you're thinking of the ticketing data as the ultimate tracking system. So as opposed to just, you arbitrarily ordering tickets for 5 of your friends, there's more of an opportunity to actually capture that these are the people that are going to the show. And so there's an ID checkpoint, and people know that in advance, so that in the future, we know that, Scott is sitting here with his friends, and here are his friends' names. So if anybody is sick, we can notify the people in the pods beside you that, someone was sick. And so it's tracking's the other, as you said.
Well, then I think that, Chris, I think that makes great sense. And I know we'd be happy to work with you guys if you're trying to think about how to do that. But at the end of the day, we could have pods in the theater area, in the seating area, and just says section 1,
right?
1A maybe has 10 seats, but for now we're only going to allow 5 in there, or pick, right, 6 people or whatever. And then the next section A2 and A3 and A4, and then those people would have to park on the east side of the building so they could come in the entrance that services A, B, and C. Kind of thing, and then the next one, and the next one, and the next one, and then people aren't walking around the whole, arena before they go to their seats.
Yes.
They're not.
Scott, so John and Megan are curious along this line of thought here, and obviously the province has set gathering limits. So how does that impact some of the, like the Canadian Opera Company or somebody who wants to hold a larger outdoor event? And I mean, to date, have we seen, and Chris, maybe you too here, have we seen any large musical events that have put protocol in place, have maybe worked with their local health unit so that they can
Not-
manage larger
Yeah,
facility?
so not in Canada, but like I said, Cola Concerts it's happening in South Carolina. I know the guy actually running it, and you can go on there, so just search Cola Concerts South Carolina. You'll get all the restrictions. So I'm actually working with a number of outdoor venues, and we would love to do something similarly in the north. So we can
I
connect
think it's
offline on that.
doable.
Yeah.
I think it's doable. It just requires very clear and simple process. This
Mhm.
can't be a complicated thing. There's only so many positions and roles, and there's only so many ways in and so many ways out.
Yeah.
And it's just very defined. And if we use the number 25%, for current patron levels. So if you could normally have 100 people in the theater, well, now you're only allowed 25,
Right.
or
See-
the hockey arena or the ball diamond or wherever,
Right.
the street concert, whatever.
Unfortunately, when you're talking about the inside venue, the metrics, you're predicated, the revenue stream, the whole business case is predicated on maximizing capacity. So that's a problem. But
Right.
when you're looking at outside and you're looking at a large space, you have the opportunity to separate people. Number one, you're not inside. So you're already outdoors, already safer, and we've proven that. So now if you separate the people, that's using, think of the inside of a horse track, kind of for example of the size, or a drive-in type concept, but where people are actually separated into pods, you have the
Right.
opportunity. What we're trying to make the case for is this arbitrary, 100 people, regardless of the size, it's arbitrary, and
We support that. We support
Yeah.
that 100%. We think that we can make plans, procedures safer to allow greater numbers of people to attend. We also think that you could have a store in Sault Ste. Marie, and just to break away from the music theme for a moment, but you could have a store that sells clothes, and you're a small business, and because of the lockdown, you're closed. Meanwhile, larger chain, big box stores that sell groceries also can sell clothes. Well, we're pretty confident that we could build systems that would certify a business that if they were in a lockdown, they can keep working, because you're either essential or you have an IPAC program in place. Well, right now the government's just made it, if you're essential, you can stay open. If you're not, you can't. Well, what if you have the right procedures in place? Then you should be able to stay open. And I think that's where
we know under the current guidelines that anything in the new color coding, you can stay open, but as a percentage of square footage, right? So there's a whole, I think Scott's got a whole,
so
formula
we
that
have,
you can define that by.
yeah, we have a whole process to come in and say, and literally over the phone, we can do it remotely with anyone, but we can come in and quickly say how many people they could have in that indoor store space. So they could reopen quickly without a lot of grief.
Yeah, the Retail Council of Canada has a calculator as well.
Yeah. Do you happen to know what the calculator is? It's per square foot?
42 square foot per person.
But that square footage is dependent upon counters and all kinds of stuff, right?
It is. So let's just say, for example, to keep the math simple, if you had 420 square feet of a, front area retail section, technically, if you had nothing in there, you could have 10 people, right? Because you got 420 square feet of space. If you put in a counter and a cash register and some displays and clothes and food and different things, then if it used up, 120 square feet of that, now you got 300 feet where you'd have to put staff and visitors. And so you just do the math until you end up with a number that you can live with based on what's in there, or you move things out of that area to allow, more people. You have to have a flow and a process for checking out and going to the cashier. It's not difficult. You just have to make sure you have it.
I just put the link to the Retail Council in the chat. So the link's there to the
good.
store capacity calculator for Ontario. But like you say, I mean, you got to plan your flow and
So how
now,
many,
in this stuff, Scott, like if you're looking at events or you're looking going into an event, how closely do you need to work with like your public health unit to ensure you've created the right kind of environment and procedures?
well, that's typically what we do, or you'd have to work with public health and they're not going to sign off on it, but they'll probably give you some tips or comments, right?
Right.
They're not going to approve your plan, but they're going to say, well, you know, maybe consider this or that as well. I think what you want to make sure you do, and I think one of the conversations, and we can probably do this or follow up with this later, but we've got a number of groups we're working with right now who are talking to the insurance industry. So what is the event insurance? What's the general liability, you know, for having a festival on the main street, right? What's that look like? Because if you've met certain public health requirements, what we're hearing is you're going to get a discount on your insurance, because the potential of having an outbreak is going to be greatly reduced, and having people sick and so on, right? So,
Do insurance companies even know how to spell the word discount?
depending on the insurance company. So what we've seen is A, you'll either get a discount if you've got it, or B, your claims experience may not go up because you're not having as many events. So even the WSIB now in Ontario is now more of a claims-based fee structure. So for example, you know, by different industry sectors. So for example, like construction was always one of the worst. You know, they're paying, and don't hold me to it, but they're paying, you know, $30 per every $100 payroll to WSIB because of the amount of claims and injuries and accidents they've had. But now, if you're a construction company, you know, maybe $30 is that standard. But if you're a company that's had a bad accident record, it may be worse than 30, maybe $40, $50 per 100 payroll. On the other hand, if you're a construction company that's had no claims, no injuries, no accidents, then you're actually going to pay less than the industry standard of 30. And therefore you can appreciate the cost reductions and savings. So we're still trying to get our head around that, more information about how we can reduce some of these events. But you know, Chris or Don or Rory, if anyone who's involved with the Music City plans, you know, it'd be interesting to see what those insurance requirements are, or what. What
we know that
clauses.
we've heard through the network that in the food service industry, that many of their insurances have been going up and rather significantly as well. It's been a real challenge, actually. And even though there's no financial support through business loss insurance, you know, it's been a tough role for that. Anyways, I just want to go back to another question here in terms of what the future looks like. And Chris, you had mentioned at one time you've heard in the industry that some folks are actually booking into the summer and potentially the fall for some events.
Right, and then that's more around. I mean, because it's all a shot in the dark at this point. But there are bookings taking place, but they're all being done on what we know is safe and allowable within the current restrictions, up to yellow, which I think is, you know, I think it's about 100 outside and 50 inside. Now, that's what, and then, you know, the thought that, you know, drive-ins are allowed. The drive-in, you know, concept was allowed. They're using that as the benchmark, as like a worst case scenario.
Right.
And the thought there is that hopefully there's other accommodations, because when this whole thing started, I mean, everyone thought it was going to last 2 weeks, and drive-ins were a safe solution. There wasn't really a plan. The work that you're doing wasn't happening in this context, you know, right, in March last year. And so now that we know the enemy, there's a lot more work being done on just the everyday requirement of wearing masks wherever you go, social distancing, that hopefully that you will be able to do things like these pod concerts, like doing 25% capacity things, you know, that could take you up over 50 inside.
Yeah.
Rather than having this arbitrary, again, number 50 inside regardless of space. So I don't know if you're familiar with the
No,
machine shop.
it doesn't make sense. If you've got 10,000 square feet, then you're
Yeah.
going to be able to have more people in there.
Yeah,
And
50 people inside the machine shop versus a small pub. It's a big difference, right? So,
right.
you know.
So that's and that's what we're driving for this as well. And I'm actually on the council for the Canadian Chamber of Commerce, a business-led return to work. So there's 20 CEOs, and I'm in that group of those 20 companies. So they're more the service provider, the airlines, and banks and different groups like that, and we're more from the infection prevention control side of it. But what we're all trying to do is find a way that we can realistically open without always having to shut down the entire region just because the government's given it a certain zone, or if companies or organizations are diligent. Listen, hospitals have been doing this for, almost since the Spanish flu, for 100 years, and they're very good at it, right? You've all probably been to the hospital at some point or another to visit a family or a friend or whatever. And when you arrive, the nurse will say, listen, before you go in, you need to put on this mask or this gown or this or that or whatever. And you say, fine, and you do it. And then you come out and you wash your hands, and, everyone's had a good experience. And the point is, the hospitals are good at doing it. Well, infection prevention control isn't tricky. It's just new. And it's just a habit forming. And, even if we think back a year ago to, March last year, when everyone spoke about social distancing. And that's when we learned not to shake hands and hug and kiss and all these things that we might have done with family and neighbors and different people over the, now, we've learned to, hey, how's it going? And the person's 10, 15 feet away or 6 feet away from you, but you're not reaching out and shaking their hand anymore. You're not doing these things. Well, now, since we've learned social distancing, we're now calling it more physical distancing, because we learned not to shake hands. Now we're learning to make sure we continue to stay far enough apart and that our workstations are far enough. And it's just a simple formula to go into the theaters, to go into an arena, go into, a street or a defined area where there's going to be, a band and stages, and say, look, our goal is to put 2,000 people here. Well, if that's the goal, then we can work backwards. We're going to need, 6,000 square feet, as in a quick example. And don't hold me to that, but you know what I mean? We're not going to have them, shoulder to shoulder anymore. We're going to have them so everyone could put their arms out.
Scott, there's some comments here in the box around live streaming, and some discussion about whether they're allowed, whether they were considered non-essential or essential. Because obviously, I got Robert on here from the film industry, and the film industry is still essential. So do you have any sense of what's happening there on the streaming side of things?
100%. So from all our information, you can do live streaming. You have to open up in a safe manner. That's, again, you have the physical distancing, you have the barriers, you have, so if you had a lead singer, and let's just say a couple, guitar, piano, drum, whatever, a couple of people singing backup, all of those people would have to be physically distant. And that's really what this POPI test, this study we're doing in March at the COC, it will give us the scientific evidence that we can say, you know what, in most circumstances, you're going to have to be this far apart, from singers and piano and different. And then people go, okay, I got that. Now, if you're going to have video or lights or anybody else, they need to be at a distance. They need to have the PPE on so they can get maybe a little bit closer or zoom in with that video camera. And you can do live streaming. And that's one of the things that we're working, obviously, with the COC on, is to get their live streaming up and running quickly, because that is a revenue source for everyone in the industry. And it can be done safely.
No, excellent. Listen, folks, I have to move on to another call, but I've put Don Ferguson in charge of the host. So please, if you wish to hang on, and if Scott or Chris, if you've got a little time to hang on, please continue. I thank everybody, and I put you in the capable hands of Mr. Ferguson. Take care, folks.
Thanks, Rory. Have a good day.
You too, buddy.
And I'm going to stick around if anyone has any other questions, or if you want to just have a conversation about this, unmute your mic and
I have,
And
I
that's-
wanna know, is your PowerPoint available? Will we be able to put a link to it?
yeah, what I'll do, I'll get this done up and I'll send it over to Don,
Don, yeah, good.
and then he can.
We will actually host this video online.
Okay.
What I'll do is I'll put a link to the slideshow right in with the video.
With it, right.
There's a question from Max clarification, and he's right. During the actual shutdown that happened in January, you were not allowed to do virtual concerts. Okay, now since then, you're now allowed to. However,
You're now allowed to, yes.
You now are allowed to, but during the shutdown, you weren't.
Right.
Okay. Now, however, noting that the film industry was allowed to proceed, so you were allowed to have 10 people on set. And then there was a whole, I know, and it was a very painful list of restrictions, but the film industry was allowed to proceed with their business. The music business was not allowed to proceed with their virtual. And that was a very confusing thing from myself, because why is that not done under the same protocols? Essentially, you have performers, they're streaming their product through a media. And why can you not perform music, but you can film a commercial?
I wish I knew the answer to that.
Yeah.
That's well, that's again, part of what we're trying to, part of the position with this council, and personally for myself, where I'm really driving it to, it's like, just, a quick example is to look at the roofing industry. You've got 10 roofing companies, and one company has 3 guys fall off the roof. And the ministry comes in and shuts down all the roofing companies. You go, well, hold on a second here, right? If you have your fall arrest, if you have your harnesses, your land, your safe work plans, and you're a safe performer, then why would you be shut down? And I think this is where we're looking at this too. So the movie industry, or commercial industry, whatever, video, they lucked out in my mind. There's probably some politics and lobbyists and stuff trying to keep people going. But at the end of the day,
Definitely the money.
yeah, it's all that stuff, right? So, and that, and you hear that, but what we need to do is say, there's no reason that the live performances can't be done as safely, if not safer, because we're already in a controlled environment, where commercials sometimes in movie sets are out on the road, they're out here, and they're not nearly as controlled, possibly, right? So I think that, now we can, but the point is, it would be better if we had a system and an approval in place, that if you were a performance production company, period, whether it was live performing or whether it was video or commercials or movies or whatever, there's a way to do it. Because you've got lighting, you've got backstage, you've got makeup, you've got props, you've got all those things, and they're all important. And I don't want someone coming up and doing makeup on performers without wearing the right PPE. What's the right protocols that they should be following? What's the cleanup procedures afterwards? And sometimes you see people, using similar products on the next person, on the next performer. It's like, wait a second. So there are right ways and wrong ways of doing it. Does that answer your question? I just want to make sure I'm not rambling on here about stuff, but.
I have a question too.
Oh, sorry, go on, Rod.
Rod Goodall, Rotary Fest. Our festival is an outdoor festival, and we use hand washing stations and the porta potties, of course. If we want to proceed with a downsized program this year, would we have to disinfect the porta potties and hand washing station as it stands after each use? And is there a way of purging the air in the porta potties, or is it expected, because this could still remain airborne in a very small space?
So it would be a heavy job to fog or disinfect a porta potty after each use, to the point that it would probably be unreasonable. However, you could do hourly cleaning or something. You could have a window where every hour, every 2 hours, whatever, there was a cleaning done. Masks would apply policy if anyone was in the porta potty. So again, then you can have ample hand sanitizer available. You know, one of the things to think about, and it's something that we've said from day one, and we've used this in hospitals for many, many years. Sanitize, activity, sanitize. So if you were going to go into the porta potty, outside the potty, you would have a little pump, clean your hand, grab the door handle, open it, go in, let it close, clean your hands. Again, do your business, clean your hands, leave, close the door, and clean your hands. Clean, 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 all the way down the line. And that's really, and you know, it's hard to teach people to do that. They don't think of opening the door, like cleaning their hands first. They just sort of grab the door and they go, oh, I should have, you know, or when they're done, you know. How many times have you seen, if you've been in a bathroom where there's paper towel in the bathroom, you know, you can wash your hands, take the paper towel, dry your hands, use that paper towel to push open the door or slide the door or move the door or whatever. And yet a lot of people, you see them and they'll throw the, you know, the paper in the waste paper basket, and then they take their clean hand and touch the inside of the bathroom door to leave.
Defeats the purpose.
Right. You know, and now, so whatever method we're going to do, we would agree on that methodology, and that's how it works everywhere. So that's how it works before you order your food to pick up. If you're getting some French fries, that's how it goes when you're going in the porta potty. If you're coming into the building, you clean your hands, you show your ticket, you're told to go into, you know, section A1. And you walk in and you seat yourself with your friends. When the show's over, you get out and leave. And so the people in the center of the theater are going to be entrant first, and the people along the exterior, the perimeter, are going to be entering last, and then they're the first to leave. Again, so we're not crossing people inside as much. And it's just the way, you know, the other day, my wife and the boys and I went skiing, and we were up at Mount St. Louis. And as we drove in, there was a guy standing there with a flag suit on. Here's where you park, here's where you park, here's where you park. And, you know, some guy tries to cut way across and the other guys brought him back. It's like, you're not parking there, buddy, you're parking here. And, you know, and they had this section. And then when they left, those are the ones that went out the first way. So there's ways of controlling it, right?
Mm-hmm. And is there a limitation if we're doing a drive-in with music, spacing for the vehicles? Typical parking lot spots is adequate?
You know what? To be honest with you, I'm not 100% certain on the drive-ins. I don't know what the latest rules are, to be honest with you. I would prefer to look it up before I give you an answer.
Thank you.
But I know that the notion is that the family went in their car, in their bubble, kept the windows up, brought their own popcorn, and watched a movie, you know, or a concert or whatever they were going to do. I don't know if those numbers have changed in terms of the physical distancing. Okay. But I think what we would do is, and what I would recommend, and, you know, quickly in March, by the end of March, if not sooner, we would have picked the venue. We would have talked to public health up there. We would have got an agreement on a number. How many people, how many spectators attend the, you know, audience, whatever. What does that number look like? And then, you know, because you can do the math on how many tickets you need to sell to break even. You know, what's the cost? What's the rental? What's the lights? What's the, you know, all the different fees, right? The bands, food, whatever. So if you know what those numbers are, it's going to cost us, you know, $200,000 to put this on. You know, then we can work backwards. Okay, so now we got 1,000 people coming at $200 a ticket, or we got, you know, 10,000 people coming at $20 a ticket. It's just, what's the deal? We got to figure it out. And then you guys know that if you have a viable, because I believe we can build the IPAC solution. You just need to do the business case and say, what's the number of people times the ticket price, you know, blah, 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 for the different costs. insurance, whatever, lights, utility, security, and, you know, depending on how many bands and vendors, are you going to have vendors there, and food, and, you know, maybe ball caps, t-shirts, all kinds of, you know, extra sort of, you know, swag kind of stuff. But then we just have to decide how big of a space we need, right? Like really, we and then I think if we had public health thoughts on this, and you guys have a better sense, maybe Dawn, from talking to them already, but you know, if the government says, the government being the government in Ontario, the provincial government says, well, you can now have outdoor, you know, assemblies of 100 people, and you're like, well, hold on a second, we need 500 people, you know, or 1,000 or 10,000 or whatever. Then we could look at a special application that if we had these rules in place, if we had these procedures, can we get a larger audience? You know,
Scott,
yes.
can I interrupt for just a second here? We're still looking at your screen share from the looks of it. And we've had a couple of questions in the chat box. A few people missed the contact information for Get Ready. Would it be possible for you to slide that back up onto the screen just while we're wrapping up, and anybody that needs to make a note can do so?
Sure, let me just...
for anybody that wants it, I did put the website for Scott's team in the chat box. It's getreadyglobal.com.
Yeah, I guess this.
But for anybody that's not paying attention, there you go. If you
see
want
that?
to write that down or make notes, you can, just while we're wrapping up the discussion here.
Yeah, and our team, like, you know, our team has been involved in setting up the center for in Essex County when all the migrant worker outbreak occurred this past summer, and looking at lodging, and we were the ones that were involved in setting up the hotels and stuff at CFB Trenton when the Canadians were coming back from Wuhan, and members of our team have now been setting up extra facility hospitals to take the overflow from some of the GTA hospitals. So we've got experienced public health certified people who build programs for hospitals, for EMS, and, you know, police, fire, whatever. And so I think, you know, we're going to, whatever we end up doing with our clients, we can provide them something that's going to be accredited and approved by Public Health and Public Health Ontario. So Public Health Agency of Canada, federally and provincially. Where we really try to specialize in is we operationalize readiness. So when the Premier says everyone has to do this, what exactly does that mean to the part-time high school student working in your store? You know, and, you know, we get so many calls from companies every day going, have we got this right? And because it's all infection control stuff, and most people don't have a background in that. So I think, you know, I think getting economies going, I think keeping the local business going, these kinds of events, you know, you bring in 5,000 people, 10,000 people, you know, some of them are going to go out for dinner. Some of them are going to go out for lunch. They're going to buy some clothes in town. They're going to, you know, stimulate the economy. I live in Midland. And for those of you that have been to Midland, we have this butter tart festival every summer. And I think we get about, it seems like 500,000 people, you know, all buying butter tarts and stuff. But what that does to the economy is just crazy, right? In Midland, you know, we get just thousands and thousands of people coming in. So we also have a couple big festival weekend nights, and you know, we'll have thousands of people down at the waterfront. So I totally understand what you're doing. I think it's great. I think it's a lot of fun. And I think it's good memories for the community, and they look forward to doing it, and their businesses thrive. And listen, we're, as Rory and Dawn know, we're keen to help and see if we can't shed some light on this stuff. So if you have a working group, if you have a team, or Chris, if you're part of this, or Greg and Rod and so on, we can have a conversation, you know, later this week or next week, and say, okay, like, what are the drop dead dates? What's the size? When do you guys actually say this thing's a go, or it's not a go? Or
Scott, I have one quick question. You said that you're working with the COC to get guidelines for live streaming. Is that correct? So there really isn't anything out there now?
No, our belief is right now you can doing it. What we're doing with COC is
So
setting up the
what the
protocol.
What the guidelines are, like you were saying, you know, how far a singer needs to be away from a guitar player or whatnot.
Well, so exactly. And right now they'll say, based on the ministry, they'll say 6 feet. And then there was a study that was done in Germany that we saw, you know, we were given by the folks over at COC. And when we read it, it was like, there's no validation to any of these comments. And therein lies the problem. That's why we're doing this tracing project in March at the COC, to actually trace the flow of these pathogens, so that we could say, so if I was the singer and I'm up there and I'm singing for 10 minutes, let's say, and I've got a band with me, and you're watching or not watching, but you're going to be coming up with your band later. How long do those particles stay in the air before you want to come up and take your mask off and be standing at the same mic or the same mic location and now singing and rehearsing with your band? Is that a 15-minute window, an hour, 2 hours? Because if you're going to take, I've had my mask off and I'm singing, and now you're going to take your mask off and you're going to be standing right where I was. The question is, are you inhaling particles that I put out? Well, we're going to have some really good scientific numbers to back that up. And therefore, if you had a festival, you might say, instead of having a half an hour between each band, we're going to have an hour. Because we would have found the science that justified that. Or maybe we're going to have an intermission where anyone who was in that area is now going to leave. They're going to come out, they're going to buy a beer, they're going to stand, you know, in pockets. They're going to be able to allow to go back in again after intermission. That's some of the science. We don't know these numbers.
Okay, well, we'll look forward to you posting that, your findings on that, I guess.
Well, we'll be posting it for sure, but we'll also be in contact with all of our chamber partners. Yeah. And so I know Don and Rory, they'll have information, and as soon as we can publish this, we'll be releasing that information, probably along with the COC. I know they're very interested. Because last summer, we really struggled to find anything, whether it was from Broadway or from Europe, you know, to find any real evidence of what makes it safe. And I think this is going to be very exciting for us, period, but as Canadians, to be able to say, there's only 2 companies right now. Boeing does this testing in their aircraft, but not for airlines, but they do it in the aircraft to determine the best seating arrangements. And a member of the Poppy team was just involved with the Mars landing, because they had to ensure there was no pathogens either going A, into space, or B, coming back out of space. So the same team that's built the Poppy system was the ones used on the chief science officer there. It's the same one for NASA. So I think it's exciting. I think this will give a lot of performers and staff confidence to go, you know, when Buddy's up there singing, we got to give him half an hour after, right? Or we don't, or whatever. And then we know. Does that make sense? Is that cool?
Yep.
Yeah, I think it's pretty interesting. I think as soon as this is available, so that's technically planning to start around March 22nd. So in just under a month, and we should have the results back. It's about a 10-day experiment. So early April.
The question on everyone's mind is, maybe this is the way to end, is what are you hearing on a third wave?
So scientifically speaking, all recorded pandemics have 3 waves.
Yeah.
So it's, unfortunately, there wasn't great science recording 100 years ago and beyond, but that seems to be from the stories that are gathered. So it seems that a third wave will be coming.
Any idea? Like, I'm hearing March. Like, what's the predictions?
Well, so the biggest issue right now is these variants, which, so if you think back to, I'll give you an example, the Spanish flu, it has a much higher mortality rate. So it's the young and the old, the vulnerable, right? The young and the old. So same with COVID, same with, you know, seasonal flu. It's the young kids and the old, you know, the old seniors are more vulnerable. And then there's a third mystery group. Now with the Spanish influenza, it was the 20 to 30-year-olds. So little kids, old people, and the 20 to 30-year-olds were heavily hit by the Spanish flu. Right now, there was only the vulnerable, mostly the old. The kids weren't really getting it, right? And you could see in the news that the university colleges and stuff like that, those kids really weren't getting sick. They weren't dying. You know, the odd one maybe, you might hear about, but generally speaking, it was the people over 75, over 85 years old. Well, now with the new variants, they're showing that some of the younger kids are getting sicker. That's a problem, because when you're bulletproof, that high risk 15 to 25-year-olds, when that crowd who feels they're invincible, when they start getting sick, then we start to have problems, because now they don't want to go out. Now life, school, all those things start to be really impacted, right? I think what you're going to see is the variants will spin now for the next 6 months, and we'll see how those impact the vaccine production. And at the end of the day, probably, one of the big billion-dollar questions is going to be, are the vaccines currently being used? Do they work on all the variants that are out there? Well, like seasonal flu, every year we have new flu shots based on the new flu. And, the jury's still out on whether this is going to be the case with COVID-19. So I think in another few months, hopefully we'll have some better idea. Hey, we do, I'll just share this one thing quickly with you all. One of the latest high-level medical thinking on this is to come up with a vaccine that may not stop you from getting it, but may stop you from getting the serious signs and symptoms of it. So for example, if we all had the flu right now, influenza type A, without any vaccines, we would all be very sick. But because our vaccines have produced to the point that we don't have huge fluid buildup, pneumonia, generally speaking, from influenza. That's how most people would die from influenza. Their lungs would fill up with fluid, and they'd basically drown, and they'd have pneumonia and die, caused by flu. Well, now flu doesn't do that very much anymore, because we've been able to put in this, to prevent the signs and symptoms that are actually fatal. So now if you heard from somebody, oh, your neighbor, your kids, just someone got the flu, you'd probably, in your mind, you're going, oh, geez, I hope you feel better in a couple of days. You're not thinking, oh my God, you're going to die. Where 100 years ago, you would have thought, oh, you're going to die now. So the vaccines have come along. Well, now that's the notion of COVID. If we can take the critical impact of the COVID virus, we can start to return people back to normal. Look, if you're sick, don't come out. But if you get sick, you're probably not going to die, and you're probably not going to go to the hospital. That would be a fairly good alternative to where we're at right now with this COVID and with the vaccines. And unfortunately, it's just going to take more time to sort out where that's going to happen. And I know, obviously, and you guys know, you're seeing in the news, there's companies and governments spending billions on this stuff, trying to figure it out. So I think you can rest assured that, you hear people bitching and complaining they didn't get this supplier, it's taken longer in Canada and the US and everywhere to get their vaccines out. It's pretty tricky work to come up with the right vaccine, produce millions and millions and billions of actual vaccines, and be able to dispense them and ship them out in a timely manner. When you think that we had no internal infrastructure, no dispensing system, no production facilities, I know people are upset about it, but at the same time, I've worked with and around the ministry for a long time, and this is pretty tricky stuff to make it work on a large scale really quickly. So I actually think they've done a pretty good job, and most people, they'll be frustrated. They wish it was sooner, of course, but I think all said, I think it's going okay. So yeah, so I think, Don, maybe we can talk again or later on, but I think if you guys want to map out what your plan is going to be and your timelines and your sizes, you know, of crowds and performers and so on. And if you have the venue, you know, picture in your head, or if you've mapped it out, where the parking, where the streets, where the barricades are going to be, you know, what's the flow of emergency services, where will the paramedics arrive? You know, if this is in July and you have someone who has a heart attack in the middle of all this, you know, how do we get the paramedics in there? So it's just, you know, everyone's worrying about COVID, but everything else is going on too. So, you know, do you have the right power setup and backups and lighting and, you know, food and diesel and resources and, you know, like, listen, this is your business. You guys know better than I do, but I know there's a lot going on when you put on a performance. So my hat goes off to you guys for continuing to drive this thing, and we're happy to be involved. So let me know. And is there any other questions or any other last minute things anyone was wondering about? You can always send an email to Don or Rory if you want later, if there's something else. And yeah, hopefully this has been helpful.
Yeah, thank you, Scott. It's been very helpful.
All right. Well, I
Very
appreciate
helpful.
it. Nice
Thank
to
you.
meet you all, and
Let's talk soon.
we'll talk soon. Yeah. Have a great
Take
day.
care. Thank you.
Bye.
Cheers.
Thank you very much.
Thank you.
I know.
Thank you.
Bye-bye.